Hello and welcome to Innovations in Liver Transplant. As you enter, if you could please type your name in the chat box and maybe your connection to transplant or liver transplant, we would greatly appreciate it. You'll see in the right-hand panel also, it allows you to chat with everybody in the conference and allow you also to ask questions as well. I believe you can drop those questions in the Q&A section. And then after our presenters, we will go over those questions that you have as best as we can in the time that we have. And ask our presenters. Now it is my pleasure to introduce the session of Innovations in Liver Transplantation, and I am Jennifer Lau. My connection to this session is my son received a liver transplant. He was diagnosed with biliary atresia, transplanted in 2012, and has been thriving ever since. So it's been a great journey so far. Today, I am honored to introduce our speakers that are with us today. Dr. Emily Perito, who is Associate Professor at the University of California, San Francisco, and is the Medical Director of UCSF's Liver Transplant Team. And then Dr. James Squires, who is an Assistant Professor of Pediatrics, Associate Director of Hepatology, and Fellowship Director for Pediatric Transplant Hepatology at UPMC Children's Hospital of Pittsburgh. So thank you both for joining us, and let's go ahead and begin.
Okay, I'll take the first crack at it. Again, Jen, thanks so much for the introduction. Thank you to Transplant Families for the wonderful invitation to present at this session. Again, I'm joined by Emily Perito to present these talks on innovations in liver transplant. Next slide. Maybe. I want to give just a brief introduction about, some of the pieces that have been put together for this innovation talk. And it really starts with the Starzl network. And so, the Starzl network is a novel learning health system focused on pediatric liver transplant. It was launched in 2017. It is the first multi-center effort by pediatric liver transplant families and providers, really to develop, shared priorities and a shared agenda for innovation in clinical care with an initial focus on liver transplant. Again, as noted, it's kind of under this umbrella of a learning health system and one focused on liver transplant. I think learning health systems are kind of novel approaches to healthcare, and they really aim to integrate quality improvement as well as management patient care, such that every patient really receives the right care at the right time every time. This is something that the Institute of Medicine has kind of put forth in the early 2000s as something that really should be a focus for clinical care across the U.S. And so the Starzl Network was founded really within this mission to provide this type of approach for kids with liver transplant. The mission of the network is stated there, right? It's to unite big data, technology, patient advocates, and transplant thought leaders to deliver the best care and develop new scalable solutions to pediatric liver transplantation, most challenging problems. We initially started out with 10 centers and have expanded over the past couple of years to include 16 centers listed there on the right-hand side. These include centers from all across the country. They include centers in almost every UNOS region and collectively include centers that provide over 50% of the transplants in the U.S. And so these are large, innovative centers with amazing people working there to support the network. Next slide. And so within this network and with those missions in mind, we had looked to launch this partner initiative. And so partner stands for patient-centered research in transplant, engaging families in transplant, right? Every everything needs an acronym now, and so this was ours. And what this project was it was a grant that was submitted to the Patient-Centered Outcomes Research Institute, which we'll talk about on the next slide, as an engagement and capacity building award. So next slide. And so just briefly for those who aren't aware of what PCORI is and kind of what it does, PCORI stands for Patient-Centered Outcomes Research Institute. And the award that we applied for was a Capacity Building Engagement Award. And so again, as noted, PCORI, the Patient-Centered Outcomes Research Institute, this was an institute that was actually part of the Affordable Care Act that was passed in 2010. And it is a nationally funded institute whose main goal are to fund research that provides patients, their caregivers, and clinicians with the evidence-based information needed to make better informed healthcare decisions. As mentioned, it believes that every step of research should be a collaboration between providers, patient partners, and other stakeholders. And so it really takes this concept of patient-centeredness to a whole new level and has put some real support and money behind those who are looking to do this type of research. As far as what we were able to secure for PCORI and our partner initiative was this Capacity Building Engagement Award. And so this was a 2-year grant, and really the kind of the main objectives of these engagement awards are to build knowledge and abilities of the community, that is the patient partners, providers, and other stakeholders, to do meaningful or to be meaningful partners throughout the patient-centered outcomes research process. Next slide. And so what actually is patient-centered outcomes research? So, this is straight from the PCORI website, but essentially it is research that answers questions that are important to patients. I think we often think of those traditional research questions of survival and complications of certain things and efficacy of medicines, but oftentimes those trials don't always answer those questions really that are important to patients. What is the burden of certain things? And we'll talk a little bit more of that. It engages patients and stakeholders throughout the process. I think, the kind of classic traditional role of the patient as the kind of consumer of healthcare and not necessarily as the active participant, this really encourages patients to become active participants throughout the entire spectrum of the research process. One big thing that PCORI looks to do is perform what we call comparative effectiveness research. And so this is the concept that out there are various ways that one may receive healthcare. And oftentimes there's very little data that suggests one of these ways is more effective than the other. And so these comparative effectiveness trials and approaches are looking to understand how practice variation that already exists may be beneficial in certain circumstances versus others. Patient-centered outcomes research also looks to produce evidence that can be applied in real-world settings. So we want to find results that are going to be applicable to all patients, across the country and not just necessarily in one specific region or with one specific disease. And it wants to help patients and clinicians make informed healthcare decisions, because ultimately at the end of the day, we want to grow these partnerships that have been developed in patient-centered care and make them more effective. And that's what this research is really trying to do. Next slide. And so, this is just some examples of what patient-centered outcomes research looks to do, right? So it aims to ask and answer questions that matter most to patients. And so this is kind of from the PCORI website again, but it's questions like, given my child's personal characteristics, conditions, and preferences, what would I expect to happen to them? Or what are our options for our child, and what are the potential benefits and harms of those options? Again, that goes back to that concept of clinical effectiveness research. And then what can I do to improve the outcomes that are most important to my child and our family? And so one of the big things that this research tries to do is identify those patient outcomes that really are important to patients, and not just kind of more traditional outcomes that have been kind of put forth by usually providers. And then lastly, how can clinicians and care delivery systems work and help to make us the best decisions about my child's health and healthcare? So again, this collaborative effort between not just the researchers and the physicians and the care teams, but also the patients, parents, and families who are living these experiences every day. Next slide. And so the goals of Partner, again, our initial project was initially to help all members of the social network and pediatric transplant community learn about patient-centered outcomes research. I think it's important to recognize that this type of research is maybe foreign to those who haven't traditionally partaken in it. And so, we recognized that there was going to be a learning curve and an education process that needed to happen. And so that was our really first goal, was to teach people about this type of research. And then along the way, begin to gather feedback from all stakeholders, again, patients, providers, technology innovators, parents, everybody who was involved within the network, about how the Starzl network and Transplant Families, our other partner, should really go about doing this type of research, because we wanted to understand, how, when we design a research project, we should learn, or we should use what we are learning about patient-centered outcomes research to take it to the next step and be able to do some of these forward. Because the ultimate goal was that together we wanted to improve the lives of all pediatric transplant recipients, including those that you know and love. And so this was our overarching goal. And so, I think specifically the end product that we wanted to develop was what we were calling the Partner Patient-Centered Outcomes Research Roadmap. And so this was going to be a tool that we could use within the network to kind of launch new research initiatives, but it would be framed through these experiences of patient-centered outcomes research, so that we would understand what patient-centered outcomes questions we needed to ask, who to include in the research projects, what are going to be the outcomes we're going to look to measure. And so, this project has really been an amazing journey coming together to try to build this roadmap that we look to use for future research down the line. Next step, or next slide. So this is just kind of some examples of kind of how we did this. We looked to, partner with technology in order to kind of get some of these educational modules out there. And so we partnered with a application business, the Real Time Clinic, and they developed a mobile platform that people could download on their phones or other mobile devices. And we were able to design these research modules and then essentially push them out through the app so that people could participate on their phones and in real time. And then along the way, we would be gathering feedback as to how they felt the module went, what they felt like were important aspects of the training that went well, what didn't go well, so that we could adapt and change along the way. Next slide. Again, another screenshot from the module, kind of showing that we really adapted what was content already on the PCORI website to essentially push it out into this app. And this was, again, the kind of educational component of the project to get all those within the network up to speed about what PCORI is and how we plan to use it moving forward. Next slide. Again, just another screenshot. There were videos that we were able to embed within the app that were taken from the PCORI website, so that people could, not just have to interact with the text, but also interact with videos and other materials that are already readily available on the PCORI website. Next slide. And then again, lastly, as already mentioned, we really wanted to make sure that all along the way we were collecting feedback, because a lot of what this is recognizing that we are learning together. And so, we wanted to understand from the patients themselves how we were doing. Did they feel like this was meaningful? And how could things be adapted in order to make sure that we really were capturing their real world experiences of the disease process. Next slide. And so, at the end of the day, what we wanted to design and what we set out to do was kind of provide 5 learning modules. These are the lists and the names of the modules. So the first module was really about, what is patient-centered outcomes research? Again, very simple question, but obviously something that not everybody maybe had a lot of experience with. Then we wanted to move on to how can one participate in PCOR research and what it means to be a participant in PCOR research. We wanted to understand what makes a good PCOR question, so that as we think about future research efforts, we would know the right questions to ask that would be able to reflect and capture those things that matter most to patients. And then we recognized, as we are interacting with patients and families as partners, we wanted to understand and educate and come to a consensus on how we can make sure that we're being heard, both physicians and patients, as these research projects are being developed. How can we engage everyone in the process? How can we make sure that what we are collecting really reflects the whole of the experience and everybody's lived experience, and not just necessarily the loudest voices or people who may be most available to participate. And then lastly, again, this concept of patient-centered outcomes, right? How can we choose what is truly a meaningful patient-centered outcomes? And this is one of the most important aspects of this, because as we launch a project and we want to collect data on outcomes that matter, we want to make sure that that outcome really is important. And so we had this patient-centered outcomes scorecard, which is a tool to evaluate, how meaningful this outcome may be within a certain community. And in our instances, it was obviously the pediatric liver transplant community. And so I think I'll stop here and I'll hand it off to Emily, who I think will go over some of the results that we've had so far. And then obviously we'll stick around to answer any questions that people have at the end.
Thanks, Jim. And thanks again to Jen and Melissa and Joseph and Transplant Families for having us. It's been a really exciting last few years to be working on this project, and we're really excited to share a lot of the results that we've gotten with you today. Next slide, please. So we are just wrapping up this 2-year partner project now. We have one more focus group. And as Jim mentioned, we've created and implemented these 5 learning and feedback modules, both self-guided versions, and we've done some of them as focus groups where people get together over Zoom and can talk through the learning and feedback about it as well. We've been thrilled to have 219 parents or caregivers of children with liver transplants participate from a number of different centers, and I'll show you those centers in just a minute. We, towards the end, have started to reach out as well to more of the transplant recipients themselves, and that's another big goal for us in the next stage. So we had 21 young adult transplant recipients join us for focus groups. We've also had 133 pediatric liver transplant providers from a number of different roles within the transplant team participate, because this learning about patient-centered outcomes research is different and new for a lot of our providers as well, especially all the critical members of the transplant team that are not necessarily involved in traditional research. And so that's been really exciting for us. And we've had 20 focus groups, which include 2 for adolescents and young adults who had liver transplants as children, 2 in Spanish for Spanish-speaking parents and caregivers, and 1 that's coming up for African-American parents and caregivers as well, to really try to help make sure, again, that we're bringing in as many voices into this feedback as possible. Next slide, please. Here's a breakdown of just one of the modules showing the participants by transplant center. And as you can see, we've got a lot of the Starzl centers participating and a few folks from outside the Starzl network that were interested, that we've been happy to have as well. These are all liver transplant parents and caregivers and providers for now, but something we're interested in expanding to other organs as we go forward. Next slide. Again, just an example of some of the participants. This one is from Module 5. We had 68 patient partners who were both parents, caregivers, and liver transplant recipients, as well as 15 providers participate in this one. As you can see, they're from a range of different roles in the transplant team, range of different times post the child's first liver transplant or their experience in liver transplant. And then we also looked at race, ethnicity, as well as where folks live and insurance status, to, again, try to make sure that we're getting representation from a lot of different voices in our community. Next slide, please. So now we're going to share with you some of the results of this and what we put together as what we're calling the partner roadmap, which is really meant to be used by the Starzl Network centers going forward as we designed patient-centered outcomes research as sort of a manual or a guidebook for how we can do this successfully based on all the feedback that we got from folks over the last 2 years in these learning feedback modules. Next slide. So the goal of the partner roadmap is to guide the design and conduct of patient-centered outcomes research in the network, and to really try to provide strategies and tools to ensure that this kind of research adheres to our guiding principles. And we'll show you a little bit about what that looks like, but essentially to improve the transplant journey for everybody involved, to really build inclusive partnerships between the stakeholders, particularly the patient partners who are the parents, caregivers, as well as the transplant recipients themselves, and the healthcare provider team, and to really share information amongst those folks, but also across centers, to try to really build collective knowledge that we can use to improve things faster and more efficiently. Next slide. Here are the different, what we're calling chapters in the partner roadmap. There is some information about assembling a patient-centered outcomes research project team, utilizing our guiding principles for this kind of research. There's a bunch of kind of how-to that we've come up with about designing the project, including how to focus on a patient-centered research question, how to help facilitate effective communication to engage and empower all team members at all project stages. How to make sure we're using outcomes or asking questions that are really going to be meaningful so that when we finish a project like this, people can use the answers and the information that we've collected. And then a dissemination plan that shares the lessons from the study with participants and other stakeholders to make sure that folks that participate in the research hear back about what we learned and how we're going to use that to change care going forward. We also have a section about recognizing roadblocks and recognizing that there are potential barriers to this work being successful, and that we've brainstormed, again, with the help of stakeholders who participated in Partner, about some strategies to acknowledge and try to help overcome these barriers. I'm sure this is something that we'll be adjusting over time as we go forward, but at least a place to start with. Next slide. I'm going to sort of walk you through some of the results here, and this will also be available on the Starzl website. All the centers will have it. We'll send it back out to the participants, and if you would like a version for yourself, we would be more than happy to share it with you also. We really, again, wanted to help make sure that this work stays really patient-centered and patient-focused. And so one of the things we asked early on is, who are the key stakeholders in our patient-centered research about pediatric liver transplant? And you won't be surprised to see patients themselves at the very middle of this star and the focus of this work. But I think really thinking about all the other folks that should be involved, that are involved in the care of kids and families, is really important for us to remember as well. Next slide. We really asked people to help us think about who are our patient partners and what are the different roles that they play in both the transplant team and sort of in an analogous fashion in the research team. You'll see around the outside some quotes from parents and providers. Then we, sort of summarized all that feedback and thought about all the different roles that patient partners play, including caregivers, advocates, interpreters, communication hubs and facilitators, the holders of memory about what your child has been through or what your journey has been like, learners and investigators themselves, protectors, and decision makers. And so really trying to make sure, again, that when we're involving patient partners who are in our community are largely parents, caregivers, but hopefully as transplant recipients going forward as well, that we're really acknowledging and leveraging all these different roles that they can play. Next slide. We really try to think with our community about what our stakeholders bring to the table. And on the top, you can see, the patient partner part of the pie, and on the bottom are healthcare providers and all the different roles on the medical team, as well as other stakeholders that are important in your transplant journey, but not necessarily sitting in the room during a clinic visit, but that should be involved if we're really trying to improve the transplant journey overall. So things like right, the policymaking organization, schools and teachers, insurance representatives, companies that provide your medications. And this is probably not a comprehensive list, but folks that we know are important. And we really tried to think about, what the special values and experience is of folks in each of those roles, so that we can acknowledge that and bring it to the table when we're designing these patient-centered outcomes research projects. Next slide. These are the guiding principles that we came up with. So as teams in the Starzl network are thinking about a patient-centered outcomes research project, we want to really make sure that the project goes back to these guiding principles. I mentioned these a little bit before, but sharing information both amongst team members, between researchers and participants, and then really importantly across centers. Really making sure we're staying focused on improving the transplant journey. And we thought, I won't go through all these questions, but we really, will ask folks as they're designing these projects to answer these questions and think about, how will this project help? How will it change care? How will it minimize the burden of participating in projects? And then inclusive partnership, really making sure that this is not something that comes from the ivory tower and is sort of handed down to folks, but that is really more of a inclusive, everybody at the table thinking about how this is going to work and what it's going to mean afterwards design process. Next slide. We asked folks to help us think about communication and consensus and how that works. Again, we used a lot of sort of your experience with the medical system and the provider team to inform what this might look like, acknowledging that a lot of us as providers and as transplant families are really lucky to have great partnerships with the families and the providers that we work with. And so we really wanted to try to think about how we could build on those trusting relationships when we're thinking about patient-centered outcomes research projects. So we came up with some, again, guidance that people can use going forward to think about working towards consensus. And again, a lot of this was informed by how we work together to make treatment decisions with families. So really making sure we're focusing on the goals of the patient and the family and asking about what those are. Acknowledging and valuing the perspective and priorities of all stakeholders involved. Considering the whole patient, not just the liver itself. Making sure that we're explaining opinions and actively listening in conversations where we're doing project design